The top three objectives for this is really to share some common teaching and learning challenges. I'm actually curious to hear some from you as well. Um, to share a little bit about how we've been integrating and building bridges across the curriculum with PhysioU at our university, at our DPT program. To share with you some data about how our students have been responding to this experience. And I think, Sam, you'll be able to chime in as well now that you guys have been using it. And then to give you little glimpses of the apps and ideas of how you might integrate it into your class. So first off, I would say that some of the common issues we've seen from our own program and other faculty have written in about is that students really would like to see some of the skills before the first exposure in lab. Because lab becomes this frantic, like, this is the first time I'm going to see it. I've got to take notes to capture everything. I'm going to get my cameras out to film everything. And before you know it, they couldn't listen to and watch the nuances of what you were doing. So we found that when we were able to give the techniques that they were going to learn this week to the students ahead of time, they're actually much better prepared for lab. They were much more able to kind of listen in and kind of, make connections because they never had to worry that this was the first and last time they were going to see the technique. So students really want to see what are the techniques and be able to reference these videos. We also found, and many faculty will say, man, I have so many textbooks because I'm pulling on this and that from everywhere that it's almost painful to keep trying to really align these resources. One book, I like how they do this. The other book, I like how they do that, but they do these other things different. So I think that this is a common challenge for all of us. The amount of material to cover and trying to get this material into an application mode to tie it to the clinical reasoning instead of just memorizing it. A few other things, how to keep the resources that we're building current or that we're using current. In PhysioU, for example, we have just partnered with JOSPT so that the clinical practice guidelines, which are embedded into all of our orthopedic apps, are continuously being updated as the new guidelines come out. And we support JSPT with all of our videos to make the guidelines that much more easy to learn from. And so I think part of the joy of working in the digital world, in the cloud, is that I can update and change things as faculty come back and say, hey, could you add this technique in? This is something that we've been teaching. Or, hey, that technique's a little bit off. Could you modify that? We just go to the green room and we film it and we change it. So it's infinitely changeable, which ties to this idea of clinical practice guidelines. You can integrate your clinical practice guidelines into the curriculum very easily. And James, if you see any chats that are coming up that you want to bring up, feel free to jump in.
Okay.
Multiple learning styles. I think all of us recognize that some students like to hear it. Some people like to read it. Some people like to watch it. And so, again, PhysioU hopes to meet that learning need from the student. And then, of course, searching all over YouTube for videos. Eventually, that gets old. It's nice to be able to come to a good resource and be able to find it and use it anytime I need. So I think this begins to save time. We've been very focused on working with different professors. We have a professor in South Carolina who is working with her neuro patients and filming samples of her neuro patients. And eventually we'll bring that in-house so that you can bring these videos up and say, how was that timed up and go? How long did it take? Was there a fall risk? Or different things like that. So, and updating lab handouts, pictures, and videos, I think as you begin to see what is in PhysioU, you'll be able to leverage that and make your lab handouts and your lectures easier, better for the students. So I wanted to just take a moment here and ask, any other thoughts or comments about challenges that you are facing that you really hope this type of resource will be able to support? So I'll just take a moment to do that.
This
This is Renee, and I'm a program director of a physical therapist assistant program in Pennsylvania.
Great.
And right, and I think one thing we look at, particularly for the PTA student, is being able to take physical therapy evaluation and then figure out from that what where they're to go with it. So kind of integrating the PT PTA relationship, I think, would be a really nice way to kind of see some growth from the apps. I've looked at the apps. I like where we are with that. So I think that might be kind of a cool way to use that to do the PT evaluation and see what a PTA would do with it.
And Sam and I were just talking before you came on, Renee. I'll show you towards the end. I have the perfect idea of how to do that. And probably I'm going to get our team to work on a sample, and I will kind of invite the PTA faculty to kind of speak into the creation of that, because I think what we can do is create simulations. For our simulations, we start with the patient from ground zero, and the student is being asked to make determinations about irritability, about what to evaluate, and then what to treat. I think where the PTA comes in then is part two of that simulation, which is patient just came back. Here is the evaluation. Now, what is your decision? Do you just follow the rule? The PT said do end range stretches to the glenohumeral joint, or the patient showed up with 9 out of 10 pain. Is that still the right decision? So, for frozen shoulder. So this type of thing, I've been dreaming and trying to figure out how to do this because I've run out of time in class. And yet, without these types of situational context building situations, I just don't see how you could do it. And so I'll be excited to show you the sim towards the end.
Thank you. Thank you.